So what happens to a claim if we put a claim into the medical services plan? And we'll talk in a moment exactly how to do that. But what happens to the claim? Well, 95% of those claims are processed by the computer quickly within a month. And then payments are made to your clinic or into your bank account twice a month. And every year, MSP comes out with the dates where you need to get your fee requests in, and then what dates the payments will come out. Make sure that you or your medical office assistant checks to make sure the information is valid and there's no typos. Make sure that the name matches the personal health care number or the PHN number. If there are issues with matching, then MSP will adjudicate different fields, or a payment will get rejected, and then they'll give you a code as to why it's been rejected, and then you need to go back and fix whatever needs to be fixed. So what do you need to submit to get paid? You need to have some billing software because everything's done by computer. So there's a whole bunch of software programs out there that are either part of your EMR or separate, and you input all of the information that's outlined on the slide here. For specialists, generally it's important to know who the referring physician is and their MSP number, the patient's name, their personal health number, a diagnosis, the date of service, the time of service, the place of service in the hospital or in your clinic or in the patient's home, and then the fee code, which again is generally outlined in your section of the fee schedule. Please keep good records so that if the codes don't go through properly, that you can go back and get it sorted out so that you get appropriately paid. As a general rule, the expectation from the medical services plan is that if you're doing a consultation or follow-up, that you're meeting face-to-face with the patient, that you're doing your general history, exam, review of any records or lab results or diagnostic reports, making sure you're keeping adequate records. And if you're doing a consultation, generally you have to send that consultation back to the family physician who's requested it within at least a couple of weeks. Specifically for consultations, they have to be requested from the family doctor or other practitioner, such as nurse practitioner or midwife, and generally there has to be a piece of paper which shows that, or they can go into their billing program and enter what's called a 333 or a no-charge referral, just to indicate to MSP that this referral's been made so that they will pay you when the referral is complete. Generally, consultations are required because of medical necessity. They're not generally used for handover of care, for weekend coverage, unless there's something very complex. And as a specialist, generally we only get paid one consultation for each patient for every 6 months for the same problem. If somebody comes in or is referred to you with a new problem that you've seen before, then that's okay. But if it's the same problem, then every 6 months. Or many sections have created other follow-up billing codes so that we don't have to do a repeat consult every 6 months. So again, this will be shown underneath your section of the fee guide. In order to bill as a specialist physician, you have to be certified by the college. So if you happen to have more than one specialty, then you use the most appropriate one for the consultation that you're doing. Again, if you're a general internist or pediatrician versus a subspecialist, then there's different ways that you may approach things. For follow-up visits and counseling, again, follow your area within your fee schedule. This generally includes seeing the patient, again, face-to-face, answering questions, doing appropriate follow-up examination, reviewing test results, organizing other referrals. Most sections have a special fee code for counseling patients with more complex issues. So if you're spending at least 20 minutes counseling somebody about special, more chronic, difficult issues, then you may consider using your counseling fee code. Again, many of the sections have created other complex follow-up visits, so you just need to review things within your section. We often get asked what happens if a patient comes in with multiple complaints, and generally we say a visit is a visit, so that if you're spending some extra time, you can't just bill multiple visits or a repeat consult. Generally answer the patient's questions, and we have to accept that some visits will be longer or shorter depending on the patients we're seeing from day to day. Again, there's a number of sections that have created a whole series of consult and follow-up fees depending on how much time you're spending with the patient. Another question that often comes up is, can you see a patient and bill for them more than once a day, whether you're seeing them in the hospital or seeing them in your office? And yes, it is possible to do it, but often you have to use a slightly different fee code or note the times involved when you've seen the patient. You use a D code to say that this is a duplicate or a repeat assessment. And then generally you put a note in under the billing field in your billing program, and then this gets adjudicated depending on the reasons you put in there. The Doctors of BC has negotiated that you can see patients up to 4 times per day in the hospital if needed. If you're called back for special indications, then again you just have to note that when you're doing a second billing during that same day. Again, physicians perform a number of diagnostic and therapeutic procedures, and often they can be billed in addition to a consult or visit. And again, you just have to look at those prefixes that we talked about before. And there are certain rules. If you're doing a lot of procedures, or if you're a surgical specialist, then there's a number of caveats to billing for different surgeries on the same patient at the same visit. And we're going to touch on that a little bit more under the surgical section, or in the part 2 of this session under the surgical section. Most of the post-op visits can now be billed separately from day 1 to 14. And again, there are some restrictions depending on the surgeries about which ones you can bill the follow-up visits for and which ones you can't. Some surgical fees, the post-op care is included, and again, it depends exactly what you're doing. If you're doing procedures in the office, please remember to include the tray fee. So this is a fee that's been set up, and there's 3 different classes of tray fees depending on what instruments you use and what disposable items you're using to pay physicians for some of those disposables to restock their office. And there's a whole list of the tray fees under the billing guide. Again, if you're doing surgery, most surgeries are in addition to your initial consultation or your visit, and some of the issues are outlined here, again with pre-post-op visits. Under the preamble, it talks about different surgeries that are included and have fee codes for them, versus surgeries to alter appearance that are generally not paid for by MSP, and you would charge privately for those services. Again, multiple surgeries can be fairly complex, whether the surgery's bilateral, whether 2 surgeries are done with 1 anesthetic, whether you're going into different body cavities. So again, in the surgical section, after this part 1, we're going to touch more on the specifics of that. There's a number of critical care fees for pediatrics and adult medicine, and also for neonatal medicine. Generally, the critical care fees will include a 24-hour service. So if you see somebody in the emergency department and admit them to the intensive care, if they're on a ventilator, then there's some fee codes that are used for that 24 hours of services. whether you're putting central lines in or chest tubes or other things, that's generally all included in the service, both for neonatal, pediatric, and adult care. If you are called back to see that patient, then that's covered as part of your pediatric and adult fee, but not for the neonatal fee. So if you do get called back to see a baby twice, then you can bill a callback or a surcharge fee for that, which we'll touch on. Again, if you are interested in creating a new fee or altering the current fees that are available, then speak to your section. Each section has generally a president and an economics advisor that are happy to answer your questions and go through how to alter or apply for new fees. Again, if you're spending lots of extra time with a patient, you may want to talk about creating extra time-based add-on fees, and some sections have already done this. So that's a general review of a number of the fee-for-service fees that we will bill as specialists. There's another separate group of fees that have been created by what's called the Specialist Services Committee.